for kick off the discussion, let's all go round the circle so everyone knows whose voices to look out for. So Raquel, could you like to start us off?
Raquel Aguiar Ibanez. I'm principal scientist in the oncology team as part of the economic and data sciences team within MSD. So I'm part of a bigger team that is the Center for Observational and Real World Evidence. And we basically support, apart from other things, we support the development of the economic evidence and the real world evidence for HTA submissions.
Fantastic. And Brett?
I'm Brett McQueen. I'm an assistant professor at the University of Colorado, so the only American here. And we do really US HTA, health technology assessment, mostly decision modeling, and collaborate with a variety of groups, including industry and nonprofits in the US.
Fantastic. I'm Freya Lees, kind of the publisher of the evidence base. Dawn?
Hello, I'm Dawn Lee. I'm the Chief Scientific Officer at ResMed, health economist by background. ResMed is a HTA consultancy, and we support companies like Raquel's in producing evidence and then submitting to each of the HTA bodies.
Fantastic. Angelica?
I'm Gianluca Baio, and I'm a professor of statistics and health economics at University College London in the UK. And our work is pretty much in trying to get everybody to do R rather than Excel.
Fantastic. Okay, we'll see how far we get with that. Okay, so maybe to start off the discussion, maybe you could all summarise the presentations that you gave yesterday. So Brett, you went first.
So we really, in the context of health technology assessment, we have shifting regulatory timelines. So rare disease, orphan therapies that are coming out, they're requiring much less time in the regulatory environment, which then shifts the health technology assessment timeline. And so really what we're looking at is situation where everyone is interested now in the uptake of these findings in terms of resource allocation decisions. The spotlight is on health technology assessment. So really that is, along with that comes calls for transparency. How did you come up with the answer? How did you make this decision? And then in addition, we have in those short timeframes, we need more advanced software because, software like Excel can be a little clunky. It takes longer to build those models. So everything is shifting towards we need more transparency, openness, as well as more efficient software to get the answer quicker or the decision quicker.
Interesting. Okay. Raquel, maybe you can go next.
Yeah, I talked a bit about the industry perspective. So things like what are the requirements across HTA agencies in terms of what software we have to use, because some of the agencies are quite prescriptive in some way in terms of what software they allow us to submit for our cost effectiveness models. And we could see that actually Excel is the one that is mostly used because it's quite easy to use, everyone can learn it, but it has quite a lot of limitations as well, so you will need to use still other software in order to be able to complete your cost effectiveness models. And actually for the more complex models it's not a fit for purpose software. So there are some barriers that Gianluca will mention later on, but basically the expectation is that we really need to start thinking about this use of more efficient software, because the timelines of the HTAs nowadays don't allow us to really keep up with the work, and don't allow HTA agencies also to validate and to critique at an accelerated time, and all this can influence actually the faster access to medicines for patients, and that's at the end of the day why we are all here.
Absolutely. Dawn, Kenneth?
Yeah, sure, absolutely. So what I bring to the party here is a real life example of how we might produce that efficient software and our learnings from our development of that. And that was very much sponsored by exactly what Raquel was saying. Those very much shortened timelines as having to do more and more complex analyses within those timelines, because the data that we're having is becoming more limited, as we're seeing more novel therapies, more accelerated access, etc. So having watched one of my colleagues go through a CAR-T NICE submission with extremely little time between data coming in and having to submit, in fact it was 3 weeks, I thought, can we not do this a better way? And on that note, we decided to build what is a demonstration model at the moment in more efficient software. What we went for was R with Shiny user interface, and the reason that we decided to do that was because having the user interface allows those people who are used to having a bit of a play with Excel, test some scenarios, to feel super comfortable and safe, because it looks and feels the same. And it allows them to do the same sort of things, perhaps with fancier graphics, so maybe a little bit extra on top of it. I presented the model that we built, And I went through what the real benefits of this are, in that we can go straight from the patient level data the whole way through to the economic analysis, the whole way through to report. We can do that all in one place. We can do all of the statistical analyses that we want to look at. We can thoroughly explore the uncertainty, and we don't have all those amazing copy-paste errors that we do from do the stats here, paste into Excel, might have a few errors. Do our economic analysis here, paste into Word, might have a few errors. Oh no, new data set, start again. So, you know, you can see what the benefits of having that all in one place and not having to do that repeated process time and time again might be. We can definitely see those benefits. And then after that, I had a little talk through our own experience, because it is a steep learning curve, learning programming these more advanced software, compared to when we're already the undisputed master of Excel. But I would say that it really is worth it, because there is so much advantage in being able to repeat and reuse those modules that we've developed, we've QC'd, we've tested, we've 100% validated in a way that we can't do in Excel. We can have our full version control in a way that we can't do in Excel. You know, just so much easier for sharing, developing, and repeating, and not wasting the effort that we've put into these models that we're building. And I think probably the last point I made was that even if the only HTA bodies that are accepting these at the moment are in the UK, and possibly a few others on a case-by-case basis, there is so much that we can be doing with this now that is not pressing submit to every single HTA body. So much use we can get out of this for early economic analysis. So informing manufacturer decision-making before we get to the HTA decision-making. And then secondly, so much we can be doing in terms of making sure those models that we are unfortunately submitting in Excel to some of the HTA agencies, because we have to, are correct. So we can double check those, fix all the bugs that we've got in our Excel models. And I've seen a case study where they've looked at an I submission. In fact, it's one of Merck's.
No pointing fingers there. Safe space.
All Excel models are like this, so that's the thing. They've looked at it and they found quite a few bugs in something that's got the whole way through the ERG review process at NICE. And that tells you what the problem with the current process is.
Interesting. Okay, I finish off some the challenges you spoke a little bit about, Gianluca.
Yeah, I think I was supposed to be talking about the barriers and in some sense play kind of devil's advocate and actually point out that this is all shiny and fantastic, but there are problems. But essentially, I failed miserably to do that because the enthusiasm that I do share with Dawn and Brett and Raquel is overwhelming. So there are challenges, there are barriers because there's a learning curve, because some of the arguments are real. Maybe you can't share the data, maybe you can't even share the full details of the model, but none of these barriers seem to me is so fundamental that should prevent you from actually going down this route, because of all the advantages that my colleagues and friends have actually discussed, and their real experience is there to show for that. So in just one word, one of the criticism perhaps is that, but this is difficult, we don't have the expertise, and this is true, but it's also sometimes, and not in all cases, a sign of something that we ought to change, some kind of paradigm shift, or maybe a better training that we need to produce for the new generation of health economists or modelers or people who work in this area, because historically the models were very simple and Excel was fit for purpose. Now the models are not very simple, and rightly so, because technology has improved and become more and more complex, and we have drugs that are super complicated and we don't even fully understand the mechanism of action. It's only fair that our models would reflect that kind of uncertainty. And to do that, the people who work on the models should be comfortable with manipulating the correct statistical software. So again, I was supposed to talk about the barriers, but I'm actually talking about the opposite of that. But I think it was a very interesting experience, and it's always refreshing to see that people are aching to actually go and do this. And granted, it was perhaps a self-selected audience, and the people who were there were already self-converted or halfway converted anyway. But hopefully, we've got some new people following, I guess.
Yeah,
it's interesting. So you all mentioned different alternatives to Excel. I mean, I don't mind Excel. I quite like Excel.
Excel is perfectly fine to do what it can do. That is the problem.
Yeah.
And like you were saying, Dawn, even if you have to because you have to, and the world will end if you don't use Excel for your final submission, I'm a little sad about that, but I'm okay. I I wouldn't have too much problem if everything that comes first, which shouldn't be done in Excel, isn't done in Excel. And it goes exactly back to your point.
Yeah, that's exactly it.
What I was going to say is that there's been a lot of talk, particularly in the first plenary, about standardization. Surely one of the benefits of Excel, apart from the fact that it's really easy to use, is at least if people are using a standardized piece of software, maybe the analysis is going to be a bit more standardized.
So, yeah, I mean, we probably got the same point here, but there's no such thing as a standard Excel model. There is extreme variability in terms of what people develop and design for exactly the same decision problem.
And it's also a sign of the times, but I think the myth that Excel is transparent, is easy, is again probably fake news at this stage.
Yeah.
Because it is easy if the underlying model is easy. And back in the 70s, models were easy. Nowadays, they're not. And so the model is complex, and the way you present it or represent it in Excel is also very complex. And you link into a cell which is hidden 5 worksheets down the line in cell X3000. And it's all messy, actually.
Yeah, and more and more we're moving to these complex models, perhaps simulation models, where you have to code a lot of this in Visual Basic. You cannot do it in standard Excel. And I've very recently seen an ERG report where the ERG basically commented that was a black box. They couldn't validate it at all, and they've had to use black box testing methods to look at it. So when people say that Excel is transparent, I think we've got to think of the fact that there are cases where that is just simply impossible to be transparent in the way that we need.
Yeah, and in terms of developing the code in VBA, actually, it's not that easy at all. I mean, once you know what you have to develop, I think you become more familiar, but the sort of errors that you get sometimes are completely counterintuitive, and you spend a lot of time trying to get rid of the error, and it's not efficient. While in R, I think you have a lot of ways around to deal with different challenges.
QCing an Excel model in VBA is a nightmare. I've done
in
quite a few of them. QCing a model in R is a lot simpler.
Yeah.
Yeah, we're still, though, I would argue, so I'm coming from the US perspective, we don't have training across all 3 groups yet. So the HTA agency may not accept R. They may only have Excel, depends on the HTA agency, as we saw. There's a lot of variability. And then the company expertise may not necessarily have R.
True.
So you need, it's going to have a sort of ramp up period where we cross over from Excel to R. And that may involve doing survival extrapolations in R and then putting things into Excel for a couple of years until we get people trained. And I know in our PhD program, we are now converting everything in our class over to R going forward. But that's going to take a couple of years and a couple of classes to perfect. I know Gianluca's part of a whole network of training courses in R, and those are great, but it's almost like we need an intro to R syntax. So I know how to code models. I know how to model, but the syntax of R is not that straightforward, and it takes a ramp up period of, I'm going to be uncomfortable. People don't want to be uncomfortable, but you have to take that step and be uncomfortable for 6 months, like you're learning a language, because that's what it is. And then, so it's just getting people over that hump of being just a little uncomfortable for a while. And that's why you need to be so persistent, and you are, to get everyone to convert over. So it's good. It's just I think we've identified everyone's going to move over to R. It's just we're not there yet. There's going to be a ramp up period.
But I think it's good that we are going somewhere. And to be fair, R doesn't even have to be the only way in which things are going. R is just a prototype of a proper statistical software, which is what you need. If you're comfortable using Stata or SAS or whatever other Python thing is proper, then it's fine. Then you have the other issue, of course, then again, if you explode the number of possibilities, then you encounter the same issue, because the HTA agencies may become familiar with R, and then you present a model done in Python, and then you're back at square one. So in terms of the standardization and going in the same direction, I think that is our best bet at the moment.
Yeah, the reason a lot of people are choosing R is because it's free and openly available, whereas for things like SAS and Stata, you have to pay a license fee. And there are a lot more, I think, possibly flexible packages that are available in R compared to some of the other more standardized software.
Yeah, something actually that I wanted to bring from yesterday's discussion was the fact that from an industry perspective, we need to support countries worldwide, and there are different HTA processes in different countries. So it's important actually that we get some sort of consistency when we are developing our models. And yesterday we discussed that because Excel is the software most widely used, most widely accepted, and particularly for those countries that maybe are at early stages in their HTA processes, there's going to be a period where it's going to be difficult to use something different than Excel. However, the fact that we have already those hybrid solutions that Dawn was mentioning before with her example, where you can really develop all your machinery of your model with an efficient software, but can allow the user to have all the outcomes that you will get with an Excel model, because people don't go, unless you are an assessment group that is really reviewing to the detail, probably the users are going to more or less check whether the results, the inputs you are using make sense, the results are making sense. And if you have different graphs from your efficient software that are already providing that sort of results, that's going to increase the transparency of the model, the credibility of the model. So there are these hybrid solutions towards, I think we all have to work with, but we have to be as well realistic in terms of realizing that there's going to be a period where some agencies won't be able to accept this more efficient software. But given that at the end of the day, the graduate training tends to standardize over time, we will see Gianluca traveling all around the world.
That's the only reason why I'm doing this.
But we have to remember though that Excel still costs money for a license, and R&R Studio is open source; it's free.
Mm-hmm.
Now, of course, with the open source, you don't get the technical support.
Mm-hmm.
And look, you're the technical right now. You're the worldwide HTA technical support. So I don't think that's a sustainable solution. No offense, but your time is much more valuable than technical support. Let's be honest. So I think it does go back to we need to rely on people like Gianluca and like Darth Working Group that are developing standardized materials that we can all rely on and say, okay, I have a reference point to say this is validated. This is an approach, and then of course, taking it to the next level of accessibility, which is what ResMed's doing with the interface that they've built and other groups have built, like Hero 3, any type of interface where that's not really transparency, that's more accessibility, which is another component that's very important, I think. So.
And actually there are a lot of free resources available. So if people are interested, I think there's the opportunity to learn by yourself, because everything is published in R, and you have a lot of trainings available as well. So it's something that if someone is interested can get that sort of knowledge. You just need the time and maybe the patience as well.
But also, I mean, and again, this is probably giving away my delusion of world domination. But I think there's a call here to try and involve statisticians at different levels. Because, for example, companies like yours can hire statisticians to work as modelers, because they would go over the kind of barrier. And in companies like yours as well, and in academia, in departments where normally statisticians wouldn't go and work, we kind of need to bring them in.
But the interesting thing is that probably companies like the one I work for have already that knowledge in-house. It's just a question of, because we've been working in developing models in Excel and getting the inputs using other software, what we have to do now is to make sure that we are integrating that knowledge together. So the knowledge is there, we just need to see how.
This is one of the things we found when we were developing the model, because we have a stats team whose focus is statistical analysis, and we have a health economics team, which includes some statisticians, but their focus is primarily on the economics. And we really found when we were working together to develop this model, it helped iron out some perhaps gaps that we might have had in understanding of going straight through the whole way. And I found that to be a real benefit to working in this way, because it does ensure that you are consistent in your analysis and how you're interpreting that data the whole way through.
Absolutely.
So that was beautiful. And I'm looking forward to repeating that.
Fantastic. Okay, well, I'd like to, if I may, just direct the conversation into the future. So where we think the future might be in terms of modelling software, HTA assessments, what would we like the future to look like, and what obstacles kind of still exist in us getting to that future?
The future is like the Matrix, when you're
where
you're just looking in code. No. I think we are moving towards a future where the back end is built by health economists and statisticians, as you just mentioned, and validated with those parties yet we have some sort of a platform up front where the non-modeler can view, change inputs, see the impact on the output. And it's not even the future. I mean, it's almost here. Like we're talking about a year away really for this. Now, HTA agencies will take longer to get there. There's going to be a lag, but I think a bunch of different groups are working on this. And I will say openness has a definition that ranges from confidential access to the code all the way up to widely open source. One thing that I would argue, since I do rely on this for my funding, is that let's go in with an openness of the modeler, not the code. Anyone can run code and say, this is my output, but if they don't truly understand, then they're not really going to be a person that I would rely on to generate accurate results. So I think we need to rely on our existing personnel or labor infrastructure in this field and say, we need to call on this person because they're an expert in this disease area and they know the modeling space here, and have that person, have incentives for that person to innovate and create new models. That's the key that I would like to see in the future, along with those other components as well.
Interesting. Okay.
Yeah. Okay. Sure. So, like Brett's just said, I think this is going to be a reasonably long journey to get to the point where the majority of the HTAs are comfortable accepting these more efficient models. I think we need to build it with the most likely candidates as we go, right? So start with those who are most technologically able and capable currently and work our way up, showing examples for the benefits that is bringing to those HTAs as we go. But in the meantime, I genuinely do think there is a lot that we can be doing now as an industry, which would be of massive benefit to us internally prior to HTA submission. And I want to see more of that happening. I'm already seeing some of that happening because we do work with PA and HERA3 as well as our own development work. And their models are being used considerably in the early feasibility assessment stage, which is great. And the more we can do every stage of this process efficiently, the more the benefits are going to trickle down and the easier it's going to get for us to make this push to this is now how we do it.
Yeah, I guess the thing to keep in mind with all this type of new, more efficient software like Hero is that you have to pay a license for that. So
correct.
There's a limitation in who will be able to review those type of models. But definitely the world is going that way. And if I may mention, the topic of eSport this year is about digitalization, and there's a lot that has been mentioned about automation. And I think that's where we are going, because there are a lot of tasks that are just repetitive and they may not require all the effort that we are putting nowadays, so that we can put the effort in things that are going to create more value in the long run.
Yes. So the value of a health economist or a statistician is not in being able to write code, right? It's in the interpretation, the specification, and the real understanding of what is going on under there. I think we've got to be not afraid as an industry that our jobs are going to disappear when we stop having to link cells in Excel for every single hour of the day.
I'm coming around to that idea. There was a fear there for a while, but if you do an analogy with traditional frequentist statistics, there are still plenty of statisticians around in the frequentist world, even though there's SAS and Stata, right? And they're easy. It's very, very easy to hit REG and then run a regression in Stata. But if you don't truly understand, the actual math behind it and how you calculate the slope, then you're just hitting buttons on a computer. So I think that's where I was going with. You're right. Health economists will still be here because it's the conceptual part that we understand the best. So I think that's an important point.
Fantastic. And Janika, a statistician, are you worried for your job?
No. No. I think I'm really thrilled that this group here already encompasses like 3/4 or even more of the whole people that we need to sit around the table. So I think it's a kind of a circular argument, as it were, because if people like NICE and the other HTAs were to do as I say and legislate that you have to do things this way, then everything would follow more smoothly. They're not quite there yet, but it's amazing that there's people in the different levels of our industry who are pushing towards that, because then it becomes unacceptable for somebody like NICE to say, you cannot send me your model in R because I don't know how to evaluate that, because it becomes a massive failure of their leadership. And so already this push from the bottom up, as it were, rather than the other way around, is vital, and it's getting us there. So I'm very thrilled.
Yeah,
it's very good.
I just want to point out that we also need a little bit of flexibility for those HTA agencies that are not as sophisticated as NICE,
No, of
because
course.
that will take quite a little bit of longer
And
time.
there might be some that will never get there, and that is acceptable, right?
Yeah.
So we do what we can now, and we are as efficient as we possibly can
Yeah.
be in the areas that we can be, and we wind that out.
Fantastic. Easy. And with that, thank you all so much.
Thank you
Thank
very
you.
much.
Thank you.
Thank you.